thank you so much for joining us this morning, Professor. I don't know if you were able to hear the conversation I've just heard with those two young doctors who did research in the depression and anxiety being experienced by so many of our medical students. You've been in this field for your entire career, decades worth of experience. What led you to decide that now was the right time for this kind of program to look at the well-being of our medical students at a very important time in their life and indeed their medical careers?
Morning, Musa and viewers. Yes, thanks for inviting me to the platform to engage in this very crucial and important discussion. So to answer your question, it's merely been really the reports of depression that are published in research, and of course the one that the young doctors that we've just spoken to have shared with us. But I think it's always been, a mission of mine, feeling that no one actually is able to bridge the gap between the young medical students when they qualify as final year students and then go into the independent world as young workers and professionals. So almost for 6 years, they are shielded under the shelter of the medical schools and universities, guidance and support. However, once they become interns, it's almost like they are left on their own. So this really was a partnership between our institution, UKZN, the Department of Health in UKZN, as well as supported by the private sector, Investec, to launch. This was supposed to actually happen last year, but because of some challenges and the delay of COVID, it didn't happen. Yeah.
So what I'm hearing is that part of the issue is that there is almost a gap that's created, that once the students are let to fly out of university into those very key 3 years of community service, 2 years of medical internship and 1 year of community service, that almost immediate cut of the umbilical cord from the university as they head out into the health system, that could be part of the problem and a bridge or a divide that needs to be bridged.
Absolutely. I think you've so eloquently expressed it. And of course, one of the other driving factors for my vision was the fact that we have the young doctors who have 3 years in the interim, to serve community service for the Department of Health or the government. And in that time, I think there is so much that I felt that could be done, either to advise them with regards to their career guidance. What do they want to do? If they want to specialize, we try and establish the links between themselves and the various academic institutions. If they want to do something else or study something else or do research in these 3 years, because they're used to studying and used to working very hard. Of course, they do need a break, but the 3 years is just an absolute perfect period for someone to start deliberating and thinking about what they want to do. Of course, there's a number of interns who know what they want to do, and they know, and some of them already started planning, specializing and reading for their basic primaries, but some don't know what they want to do. So this was also meant to mentor them and support them and guide them during this interim period.
These students are entering a health system that has always been under pressure, and even more so this year as we've battled this pandemic. The 2 years of their medical internship, like you've just said, is supposed to be there for them to be exposed to various specialities to help them make up their mind as to where they want to end up. Is the problem that because our health system is already so stretched, junior doctors are going into the system and there isn't almost enough hands to help them be exposed to these specialities in the right or the most conducive environment, because they're actually just expected to hit the ground running and to do the work that doctors do because there's just never enough doctors around in the first place?
Yeah, I think it's multifactorial, and what we are mentioning is one of the factors. And again, as the doctors mentioned, sometimes us as seniors, we are not the exemplary and we don't offer the support that we are supposed to the young doctors. Sometimes we are too critical of them, too abusive of them, and not really supporting them. And what I always say to the doctors that I work with is, when you're dealing with young doctors or registrars or medical students, treat them as if they were your own and look after them the way you were to if you were to look after your own daughter or son who's in the field. And I think also, there are stressful conditions make things difficult. And I mean, there are amazing doctors out there who extend their hand, who support interns, who really look after them. And those doctors, we want to salute them and say, continue with the amazing work that you're doing. But of course, there are other doctors who are not doing that, who are really destroying the souls of these doctors. And to those, we want to say, be the change that you want to see and be the exemplary role models for our young doctors. And again, when it comes to interns, there are amazing interns and there are also bad interns who flunk work and they're committed, they're not compassionate, they're not kind to patients. So to those interns also, we want to say, try and be the best version of yourself. And as a result, to try and acknowledge these amazing interns and also the doctors, senior doctors who are supportive, we have decided as our School of Clinical Medicine to hand out acknowledgement, certificates of appreciation. These will be doctors, the interns that are nominated by their own colleagues, and also interns will nominate senior doctors who they feel were exemplary and were the real father figure or mother figure that they wanted in the workplace. And that will be awarded at the end of each year to all these doctors who will be nominated. And I'm also happy to mention that the South African Committee of Medical Deans, of which I'm a member, is very keen to support this initiative. So KZN actually was more like a pilot, and we're hoping that next year it's going to be extended to all the academic institutions. And this will apply more so for hospitals that are closer to the medical schools, because those interns have a proximity to the academic centers and they can spend time on weekends or when they're on holiday to spend time in the different specialties that they would like to specialize in. Those who want to go to private practice, we also have GPs who are amazing, who've shared the route in terms of what to plan for, what do you need to do if you want to go into private practice. And if you feel medicine is not your field, again, there are other aspects, corporate, business, and we have identified people to assist with those. And in terms of financial, mental wellness, we're going to have workshops every month. And this is really intense center. Interns will dictate what aspects of talks they want us to cover, and we'll make those resources. And we formed a committee here at medical school, including Dr. Rina Singaram, who's been really helpful in establishing this, and one of the interns, Dr. Andreas, as well as Dr. Larissa and Dr. Mint, who are part of the Department of Health intern curators.
Well, it certainly does sound like very encouraging news and a few steps in the right direction, if I may say so myself. That is the Dean of the School of Clinical Medicine at the University, the UKZN's School of Clinical Medicine. That is Professor Ncoza Dlova, who is the founder of that very, very encouraging program that is being entitled the Intern Mentorship and Support Program.